So one of the questions that comes up whenever tax dollars are being used to fund government services, and especially treatment for mental health issues, is, you know, how big of a problem is this? And in 2006, the Office of Problem Gambling commissioned a Prevalence study in the state of California. Talk about that study. What was its purpose and what did they find?
At that time in 2006, there had not been a statewide survey of gambling addiction since back in the 90s. And with the expansion of all the gambling in California, with the Indian casinos, as well as the lottery and the horse tracks, no one really knew how many pathological gamblers were out there. The State of Office Problem Gambling opened its doors in 2003. So one of the first things they did when they became officials was say, we need to figure out how many pathological gamblers are in the state of California.
Sure.
We need to figure out who they are, what they look like, where they live, how much harm or damage they're doing to their lives, and figure out how many people could access or would access services. So what they did is that they, in 2005 actually, ran the largest statewide prevalence survey of gambling behaviors and gambling addiction ever done in America.
Wow.
So the methods was very, very simple. They got random phone numbers from the phone book and some cell phones, and were able to get 7,000 Californians randomly called up to do a 30 to 45-minute interview with gambling researchers. The actual study itself was conducted by a group out of Chicago called NORC. They've done a lot of gambling research for a long, long time. And spearheaded by Rachel Volberg, who's done a lot of gambling epidemiologic work in her career. So the main results of this survey, and remember, it's 7,000 people out of 26, 30 million California residents. So it's still a really small sample, but that sample is supposed to represent all of California. And so what they found are the following things. Number one, first, that lots of Californians gamble, that over 85%, or actually over 83% of Californians had gambled in their lifetime in one of the 4 formats that are legal in California: card rooms, horse race, lottery, or tribal casinos. What they also found was that 60% of Californians had gambled in one of those 4 formats in the last year. So it tells us that gambling is a very widely popular form of entertainment. It's something that's embedded in a lot of the lives of Californians. It's done on a regular basis. As an example, we know that that number is similar to alcohol, where about 60% of Californians have had a drink in the last year, which means that there's a big percentage of folks that don't. But that, again, alcohol is a very common activity. It's available. It's readily available. So that was the first thing they found, was that gambling was very popular. Of the 4 forms of gambling, what was the most popular was actually the lottery. And that mainly had to do, again, because it had so many different availability and access. 20,000 lottery outlets throughout California, which is why it's easy to go get one. But the one that generated the most money was actually still the Indian casinos and the brick-and-mortar casinos. Then we get into the second part of the study, which is looking at what is the rate of problem gambling and pathological gambling. The way this study characterized gambling was one of 3 categories. Number 1, social/recreational gambling. You gamble for fun, you do it as entertainment, you do not incur any sort of damage in your life, and you meet maybe 0 or 1 criteria of DSM-IV criteria. The second category they looked at is problem gamblers. So if you had 2 to 5 criteria of DSM-IV, they considered problem gambling. Third was pathological gambling. You have 5 or more of the DSM-IV criteria, you are filed under the category of pathological gambling. So of these 7,000 respondents, what they were able to show was that in the pathological gambling category, that 1.5% of the state met criteria for pathological gambling. Now, that doesn't sound like a lot, but in comparison to other mental illnesses like bipolar disorder or schizophrenia, those diseases are also around 1%. What it translated to was about 300,000 approximately pathological gamblers living in the state of California. And at the time that the study was done, there were 0 state treatment dollars for pathological gambling.
So in one respect, the government is getting tax revenue from the casinos and other gambling venues, but no money is being put back into the system for all of the lives that are being negatively impacted to the tune of potentially 300,000 plus individuals. And that's just pathological gamblers.
And correct. And that was the whole point of the survey, is to say we need to know how many pathological gamblers are out there that require help. For the category problem gamblers, again, those who don't quite yet meet full criteria for DSM-IV, but are already starting to incur some damage and harm in their lives, that number was 2.2%. So that translated to well over 450,000 California residents. So combined, if you combine the rate of problem plus pathological, that number reaches 3.7%. So the idea is that almost 4% of our state of California, or almost 1 out of 20 individuals walking the streets, have incurred damage and harm in their lives or suffering from symptoms of gambling addiction. So when the study came out, it was one of these studies that laid the baseline rate as a very high rate, one of the highest in the nation, even higher than many parts of Nevada, higher than other states that had mature gambling markets like the Midwest or other gambling destinations. But the idea, again, very simply, is that this was a very high number. So of that 3.7%, who had the highest risk? And surprisingly, there were 3 categories of groups that had the highest risk of pathological gambling, and they were African Americans, disabled, or unemployed. If you belong to one of those 3 demographic categories, your chance of being a problem or pathological gambler were almost 4 to 5 times higher than expected.
Wow. That's quite high.
Quite high. And so it was an example where this study allowed the state, as well as us at UCLA, to identify these are the 3 target groups we really need to do outreach to have prevention services, and eventually treatment. African Americans, disabled, and unemployed. Now, other ethnic groups as well, Hispanic Americans showed an elevated risk. Curiously, Asian American populations showed a lower than expected rate. So their rates were less than the state general rate. Now, one of the criticisms of the study was that the sample of Asian communities and Asian populations was not equivalent to the other ethnic groups, nor were there a lot of the interviews conducted over the phone done in native languages.
Right.
So what we found, contrary to some of our work with the Asian groups, is that the state saw a lower than expected rate across the state, but when you actually go into Asian ethnic communities, that rate was actually a little bit higher. Now, one of the fascinating things, in addition to the rate being around 4%, is that this study showed that if you were a pathological gambler, your chance of smoking more cigarettes was higher, you're more likely to have a drug or alcohol problem, and you were more likely to use marijuana and illicit drugs. That fundamentally makes sense to us because we know that to be true, but if you look at it in the lens from public health, it means that if someone is an untreated pathological gambler, not only are they struggling with gambling addiction and finances, but they're also more than likely struggling with drugs and alcohol, which also creates a whole other host of problems and damages and harms and things like that as well. So it was very important to bring out that story.
It also seems to suggest that, you know, people who are providers for pathological or problem gamblers need to be assessing for comorbid substance abuse disorders. But it's interesting, in the substance abuse field, has the question been raised or answered as to what degree people who are specializing in substance abuse treatment actually screen for pathological gambling?
Well, that's a good question. That's one of the things we found over the last 5 years in working with substance abuse providers, that many of them were aware but not actually screening. And again, it's so critical because if you have one disease of addiction and then you don't address other co-occurring addictions, both addictions will just come roaring back. So certainly we've done a lot of work to try and inform and our substance abuse colleagues about screening for gambling. The last finding that's very important from this study of the prevalence survey was to look at helpline awareness. And it basically showed that only 1 out of 5 Californians were even aware that the state had a 24-hour gambling helpline, 1-800-GAMBLER. So it tells us, again, are people aware of the suicide hotline? Are they aware of other hotlines and helplines like the smokers 1-800-NO-BUTTS? Those awareness rates were much higher. So again, what the survey did is give the state a roadmap of how to address and allocate prevention and treatment and outreach services. Essentially, it showed this picture back in 2005 of that lots of Californians gamble, that 4% of Californians that gamble are really suffering from the side effects and damages from gambling addiction, that most Californians were not aware of how to access services. And that really then gave the state a roadmap to say, these are the things we need to work on over the next 5 or 6 years. So all the services from the California Problem Gambling Treatment Service Program are really started from with that lens in mind of the results of the Prevalence survey.
It emerged out of the Prevalence study. It gave the government leverage to say there's a need here and we need to start addressing it.
Absolutely, and gave a roadmap. The question now becomes is when, if and when do they repeat the statewide survey? So for instance, they do it 5 years after treatment services have been there. We've seen gambling continue to expand since 2006. So, but to run a statewide survey like this is very, very expensive. And so, you know, it's unclear when that actually might happen again.
Regardless, at a minimum, the Prevalence study established that there were certain populations that were at risk, that it was a problem for a greater percentage in the state of California than other states around the country that offer gambling venues, and that there was a lack of awareness about the resources for how people could get help for gambling.
Absolutely. And as another curious fact, if you look across the state of California to which regions have the highest rate of gambling addiction, it's northern San Diego. And it's not a coincidence because that's also the highest density of brick and mortar casinos down in that area as well. I would recommend that all of our treatment providers view and take a look at the results of the Prevalence survey.
Where would they find that?
They would be able to find that on the Office of Problem Gambling website, www.problemgambling.ca.gov. The full report is about 100 pages or so, but there's a shortened executive summary. And it's a good example of getting a real handle on understanding gambling in our state for anyone who's interested in learning more.